My name is Dr. Annmarie and I'm a consultant clinical psychologist working at Brainkind, delivering brain injury interventions in prison and probation services across the UK. The prevalence of traumatic brain injury in offender populations is consistently found to be high, around 50%. This is in direct contrast to the general population, where prevalence estimates tend to fall between 8 to 12%. Brain injury, regardless of acute severity, is often associated with a range of cognitive, emotional, and behavioural difficulties. Within offender populations, these things are associated with increased aggression, increased rates of reoffending, and greater mental health difficulties. Discipline and order are central to how prisons function, and it's not difficult to think about how this is likely to present a challenge to those with brain injuries. Indeed, studies have shown us that men with brain injuries in prison often have high rates of incidence, are more likely to use health and social services but less likely to complete treatment, and that they struggle to adjust to prison life and rules. This results in poorer engagement and ultimately worse outcomes. So whilst we can't definitively conclude a direct causal link between brain injury and criminality, there is clear evidence for the importance of brain injury interventions within the criminal justice system. And this is why, over a decade ago, Brainkind, formerly the Disabilities Trust, developed the Brain Injury Linkworker service, a service designed to deliver short-term brain injury interventions to men in prison and on probation. This study was part of a wider service evaluation. In this study, we looked at 70 men who were seen in prison and probation services across South Wales, all of whom screened positive for an acquired brain injury on the Brain Injury Screening Index, and all of whom completed 3 to 6 sessions with a Brain Injury Linkworker. We assessed the men we work with on a range of outcome measures, but for the purposes of this study, I'll be discussing the GAD as a measure of anxiety, the PHQ as a measure of low mood, and our perceived change questionnaire, a questionnaire which we developed to look at a range of domains that we aim to tackle with our brain injury link worker interventions. For example, we ask the men both at the beginning and end of treatment, how well do you understand your brain injury? How able do you feel to discuss your difficulties with others? Or how able are you to participate in the prison regime? It's important to note that all our interventions take place in the context of staff training. We train prison officers, probation officers, healthcare and education staff to understand brain injury and support the men they work with. So what did we find? We found significant decreases in both anxiety and low mood symptoms, and when we looked more closely at this data, we could see that the majority of men moved from the moderate to severe to mild to minimal ranges on both measures. We also found significant increases across all domains of the PCQ. So the men were rating that they had improved understanding of brain injury, improved ability to explain their difficulties to others, they were more engaged in the prison regime, and felt they had a better ability to keep themselves out of trouble. And we were able to corroborate these findings with other data that we collect. So for example, when we looked at the regime data, we could see that the majority of participants were on the standard regime at the start of treatment, but had moved to the enhanced regime by the end of treatment. Within the UK system, being on the enhanced regime means that you're able to have a job, you have increased visiting hours and more money to spend in the prison shop. So all things that make a significant difference to the day-to-day life of men in prison. In conclusion, the Brain Injury Linkworker service is often the first opportunity that men have had to discuss brain injury and its implications for them. They often haven't attended hospital when they've experienced their head injury, and if they have, they may have been lost to follow-up. Secondly, the views of offenders are rarely sought, but I hope that today this presentation has demonstrated the importance and value of their feedback. Thirdly, the criminal justice system is not a place that neuropsychologists usually work, but I hope today I have illustrated the importance of this work. And finally, I just want to thank my wider team who work exceptionally hard to make the Brain Injury Linkworker service the success that it is.